Okay, so hello everyone. In today's Side Talks episode, we are with our expert speaker, Ms. Jessy David. It's a pleasure to have you here, ma'am. So, giving a brief introduction, Ms. Ma'am is a counseling psychologist practicing at her own startup, which is Let's Talk and Heal. And she has done her master's in psychiatric nursing and a counseling psychologist. She's a registered nurse with Indian Society of Psychiatric Nurses, and she's a member of Chennai Counselors Foundation. It's a pleasure to have you, ma'am. The stage is all yours.
Thank you so much, Dr. Arshia. First of all, I thank Almighty for giving this opportunity, as well as I thank for this platform, Psych Talks. And without taking much time, let's hit into the topic. Today's topic is about assertiveness. Let me give you a brief introduction about the topic. So, assertiveness is the ability to express one's needs, opinions, and feelings directly, honestly, with respect, and at the same time, respecting the others' needs and others' rights. So, this is the brief introduction about assertiveness. Now, coming to the definition of assertiveness. So, it is the quality of being self assured and confident without being aggressive to defend a right point of view. So, in psychology or psychotherapy, this assertiveness can be considered as a skill. So, it is a master skill which is very essential in a part of communication also. So, that is the definition of assertiveness. So, why it is important? Why we should be assertive? The first thing is, so each and every individual will have a goal. To focus on the goal, a person need to be assertive. Second thing is, it is being self-aware. So being self-aware means being aware of your own emotions, your thoughts, your feelings, your behavior. So when we are more aware about ourselves only, we can take a control about our environment too. So, so assertiveness is a skill which helps to maintain your self-awareness. The third importance is it is being true to yourself. So if you're going to be assertive throughout your professional life or family life or under any circumstances, you like you're going to remain true to your own self. You're going to remain honest to your own self. There's no need to lie. There's no need to manipulate. Person who are very assertive will have the good standards and good qualities. And the next importance is it helps you to build the self-esteem. Self-esteem is having a positive attitude towards own self, the ability to work effectively, the ability to establish the confidence in a more calm and composed posture. So that is the self-esteem. And it also self-respect. Assertiveness also helps you to increase your self-respect by enabling you to know your own self-worth. Right? And there are some other important um, importance of assertiveness. That is, in kind of working in industries or in any profession, or when you step out into the world itself, you need to be assertive. Why means it helps you to manage conflicts. So conflict management. So we know what is a conflict. So a disagreement between a two concerned person or two important parties. So what happens? The disagreement will raise into a argument. So a assertive person will never put their energy or time into any unwanted arguments. Definitely they will go into the resolution, or definitely they will safeguard their own energy. So assertiveness helps you to manage the conflicts. The next other importance is stress reduction. So people who are assertive can easily reduce their stress, anxiety reduction, and it boosts the decision making ability. People who are assertive can make decisions wisely, and they can make the decisions without much delay, they can make the decisions, and they improve the communication pattern. So nowadays we know the communication is the base for any kind of relationship. So when there is a proper, open, honest, and direct communication, that itself will solve many problems, or that itself will prevent many problems. So it improves the communication, assertiveness. And finally, the important thing which is needed for each and every one of us is assertiveness helps in problem solving. So when there is a problem, we no one will go and jump into the solution. Every the assertive person, what they will do, they will analyze the problem. What is the problem? Next, they go in for the causes of the problem, and because of these causes, what are the consequences of the problem? And then they will go in for the solutions. So probably they will list out 4 to 5 solutions. So we all know what is a problem solving approach. For example, I will give you an example. A, a person with a alcoholism. So he is addicted. That is, he is having ADS, alcohol dependence syndrome. So he has been addicted for 1 decade, like for example, 10 years. He's not able to get rid of it. So this is the problem for the person. So now, if the person or the caretaker of the person is assertive, they will go in for the causes of the problem. Maybe the peer pressure, or the cultural influences, or a societal influences. Maybe due to his work pressure, he would have been addicted. He would have been started as a social drinker. Finally, it would have become a habit, and then a dependency syndrome. So they will list out the causes. And next, they will see the consequences. A person who is ADS is going to have many consequences. Not only the person's physical health is affected, but his mental health is getting affected, his family pattern is getting affected, and his financial status is getting affected. And in society also, his grade or his reputation is getting spoiled. So all these are all the consequences. So the caretaker, or if one person is assertive in that family, what they will take the necessary step. The first, the problem solving approach. First, they will change the peer surroundings, or else next they will go into like cutting the financial costs. They will not allow that person to take the financial income. So when the finance is not going to the person's hand, definitely the habit may cut down. And maybe in the final stage, they will seek the medication support, psychiatric visit, or de-addiction center. So they will work on with each step. Okay, so problem solving method is also here. It's like a trial and error method. They will try the first step, they will execute it, they will plan, execute. Finally, they will evaluate the results. When the results are really acceptable, they carry out with the first approach. When the first strategy is failed, they will go in for the second approach. So this is a problem solving approach. So this techniques and all we used to teach in the assertiveness training. When we see a alcoholic dependence syndrome patient at clinics, before they are getting discharged into the society, into their house, we will give them the assertiveness training. For example, we will ask them, you are going into the world again. They may be into the de-addiction center for the past 3 months or 6 months. They'll be having all the medication support, counselor support, and all exercises, all kind of group sessions. Everything will be benefit for them. But finally, the individual has to go out, right? So we will tie them up with alcohol anonymous groups, and we will give them the back end support. But as a person, how the person can help himself is only being assertive. So we will give them a role play. or a psychodrama. In psychotherapy, we call it as a psychodrama. So, in which we will give them up one situation, like you're going to your house and your friend is inviting you for a birthday party or a marriage party, and you know very well when you go there, there is going to be a drinks party. So, how will you assertively decline the invitation? Because we know this assertiveness is not rudeness. It is calm, composed manner, at the same time respecting yourself as well as respecting others' rights. So, in which way we will train the individual? So, here the individual will be trained, will be asked to say, I can accept that this is very important occasion. I am so happy for it. But my condition is I have taken treatment, and for my own welfare I will not be able to attend this party. Please do not mistake. Like that, very politely, confidently, in reassuring way, the person can deal that situation. This is one of the finest example in a psychiatric setting. We deal with the patients. So this is important for problem solving assertiveness. Next, coming to the types of communication. So there are three different types of communication. So one is the passive communication skill. Next one is the aggressive communication skill. The third one is the assertive communication skill. So passive means they are not active. So passive is the
Both gentle
opposite of,
and submissive kind of thing.
yeah, exactly. So they are very scared to say what they think. So they avoid the eye contact, and there will be low self-esteem, and they will not have an open body posture. They will be slouching, and they will always be people pleaser. They will put others' need first. Okay, it won't be an equal need. They will always put the others' need first, and they will be pleasing people. So these are the attributes of passive communication. The next comes the aggressive pattern. So the aggressive pattern is another extreme level of communication where the person will outburst with anger, extreme rage, more ferocious, and they will have a more dominating, authoritative tone in their voice. And so, what happens finally? This person's way of behavior will reduces others' self-esteem, right? And they always put their needs first, and they want to win for themselves. They will not prioritize others' needs. So these are all the aggressive person's behavior, and they also have a staring look over others, so which will be often threatening for others. So third type of communication is the assertive point of communication. Here, the person will express them very clearly and confidently, and they maintain the eye contact. So maintaining eye contact helps the other person to feel that they are heard. So listening is an important skill in assertiveness, and it also increases their own self-esteem. They have a welcoming posture, and they act in a calm and direct way. So there is no manipulation. When we say they act in a direct and honest way, there is no need to beat around the bush. There is no need for a third person to enter. There will be always a open one-on-one communication, and they will aim to express their own needs. They will not backslide from expressing their needs. Fine.
I'm sorry to
Next,
intervene. I have few questions. I think I can ask you these. So
sure.
when you talk about the types of communication, it is very like a subtle difference between aggressive and assertive communication, because both come in line like parallel things, because both are showing their needs. The only difference I find is aggressive is more of a dominative thing, and assertiveness is something like a milder form. So in situations like a psychodrama, whatever you said, like in alcoholics where we give them treatment, So in that, I think in that scenario, if we take a closer look, there are high chances that the person can be aggressive because they are trying to prove their point, and in that point of time, it is like more prone to get aggressive. So what are the steps that we can take when not to be aggressive? Because that is a very thin line of difference, right? Because both are similar, both have to show their views. So how can we not be aggressive in certain situations?
You're asking how the patient can't be aggressive or how the
Yeah,
counselor.
yeah, how the patient should not be aggressive in such situations, because they have to be assertive. They have to say their rights that they don't want to go and take the drinks in the party, but at the same time they should not be aggressive. So how can they manage that?
Yeah. Usually, as I said earlier, it will be like a trial based method. Fine.
Okay.
The person, once they are getting discharged or once they are within enrolled within the inpatient setup itself, many a times a person will undergo this aggression. As like
Okay.
that, they will not come out of the addiction. Fine.
Yeah.
So, n number of practice sessions will be given for the person, and in places like Nimhans in Bangalore and all, for people like other disorders like bipolar, the people with
Hmm.
aggressions, they will have a timeout room.
Hmm.
Fine. So timeout room means it will be like a room uh, where no one will be there. The person has to spend 10 to 15 minutes being there without interaction with any other person. It is like what to say, self realization for their own aggressive behavior. So only when the person is attaining that self realization, okay, this aggressive behavior is having some bad consequences for myself. Only when the person is having that insight, they will get rid of this aggressive behavior progressively, gradually. That progress will take place gradually, slowly
Not
only,
in one session or one
not
training,
in one session,
but in
not in
the
one session.
progressive stage. Yeah.
And they should have a continuous follow up with the therapist or the
Okay.
psychiatrist. They should come up for the follow up sessions because there is a high chances for this kind of patients to get into relapse. Okay,
Okay.
so
So
we have
even persons with personality disorders can experience have a self realization, and they can understand that they are being aggressive, because personality
yeah,
disorders are something where people don't have the insight that they have some issues with them. So
yes,
as you
personality
say,
disorders we can like to some extent we can structure them. Personality of an individual can't be changed overall. We can
yeah,
structure them to some extent, but
oh,
these other conditions we can shape them into the previous, the before the addiction, how they were. So that stage we can bring them. So that
okay.
is the
Since we came with personality, I wanted to ask one more thing. See, there are many personality types as we see in the Big Five, Ocean, this acronym, and all these things. So, which personality type is more prone to have assertive nature?
mm, people who are ambivert as well as extrovert. Both
Okay,
tend to be more assertive than the introverts when we compare. The sensitive people, the introvert peoples are less assertive than the ambiverts and the extroverts.
okay,
So they are tend to be more assertive. Nowadays, like it is taken as a training itself, assertiveness.
yeah,
So it is needed for each and everyone at all the time.
okay,
So we can escape from many problems when we are more assertive.
yeah,
Thank you. Okay, can we move to next topic?
yeah, sure, ma'am.
Yes. So some of the assertive communication techniques, that is using the I statements and as already I told, being honest, using direct communication, and practice active listening. Like one person is speaking, if the other person is over some preoccupied with some other thoughts, means the other person who is sharing their emotions feel unheard. So the assertiveness should be maintained in both ways, and it should be the person should be staying calm and collected and respect others' rights and opinions and use positive body language and express empathy. So we know sympathizing is very easy. We can feel so problem like that, we can say and move on. But
Mm.
expressing empathy is feeling with them, feeling for them, and feeling with them. Like putting ourselves in the situation and realizing the situation and bringing out a solution for them, not only feeling for them, but bringing out a good quality solution for them. That is the empathetic approach, as well as set boundaries. So when it comes to professional assertiveness, set boundaries carefully. When it comes to family assertiveness, set boundaries clearly, confidently, and have control. And use reflective listening. So, reflective listening is you know what you think, you know your emotions, you know your feelings, and you know your behavior. You have the control over your own thoughts and behavior. That is reflective thinking. Before doing the behavior, in thoughts itself, you will process everything in your mind itself and then you react. That is called as reflective listening. And ask for clarification in between if wherever you need. For example, if a person is a manager and there are subordinates for him, the manager, whenever he is having a meeting with them, is it clear? Do you want any clarification? Like this phrases the person can use in between the meetings so that the other persons also will have a time to raise their questions or clarify their doubts. So ask for clarification. And when it comes to a counselor, as a counselor, how we can use this clarification? When a person is stating that problem, we have to restate the problem. Okay, you said that you are facing with some domestic abuse. Is that so? Is that what you are trying to say? Like that, when we redefine the problem in a simple phrase, the person will reanalyze. Yes, that is what I said. Or else, if we have misunderstood, the person may correct. So that is called as clarification. So as a counselor, we have to clarify the client's statements
We
by
need to
restating.
rephrase the situation which they feel, which they
Yes,
experience. So in that
yes,
case, their load will be like lightened, and they'll be giving us more information, insight about it.
yes. It helps
Ma'am,
them
one
to
more thing.
comprehend.
Sorry to intervene again.
Yeah, please.
See, what I got a thought that if a person is emotionally cold, they don't understand our feelings. So in that case, assertiveness needs to be from one side. See, if I am assertive and the front person who is facing me, if that person is not assertive, if that person is not like emotionally cold and not able to take up my feelings, so what can happen to as a consequence to me? See, if I am not
Yeah,
feeling heard, I will be hurt, right? So in
yes,
that case, again, the cycle of communication breaks, right?
yes.
So when are the scenarios when we should not be assertive? To who we should not be assertive? That is my simplest point.
Okay. So when you see, there is only a thin line of difference between assertiveness and being rude. Sometimes the person on the other side may misinterpret your assertiveness as rudeness.
Yeah.
Fine. So during that time, the person who is assertive, if they are able to perceive that, if they are able to understand that, the person can be less assertive to hold on with that relationship or to value the friendship, not to make it as a complicated issue. They can minimize their assertiveness in that point. Fine.
Mm.
Actually, that is also a like a kind of assertiveness only. Okay,
Yeah.
here they are becoming less assertive to make the other persons to make them valued. Fine. Because the
Yeah.
other person already know that the other person is emotionally cold. Emotionally, they are lacking that apathy or the emotionally they are weak. So these person will they need to continue the relationship or they continue the friendship. So that time what they do, they will not make the complication complicated.
Yeah.
They will not make the they will not make the communication complicated. They will divert in such a way that it favors both of them. They have to speak in such a way that the communication or the argument ends in a smooth and favorable way. So, in which case, the assertive person may even feel lost, but still it is not a loss when they value the person's relationship on the other side.
Yeah.
Fine?
So in that case, we need to lessen our assertiveness, and we have to consider what, like what is working, and then we can be assertive later on to prove our
Yes,
point,
yes,
to prove our
yes.
emotions. Right. Okay. Thank you
Yeah,
so much,
yeah.
ma'am. You can continue. I am intervening you in between.
No problem, no problem. It should be like an interactive session.
Yeah.
Yeah. And in psychology, we have to understand every person will not have the insight about their problem. So nowadays we can see like people with any kind of illness like hypertension or diabetes, they are willing to go and visit a doctor. Whereas in psychology, when they face with problems like anxiety, depression, or any kind of fear, stress, they are not willing to go to a psychologist or a psychiatrist. Still, the stigma is there. So, whenever we are processing in a counseling session, the insight should be built into the person. Wherever there comes the acceptance of the problem, the assertiveness will follow. So, as a counselor, we must make them to accept the reality. So, it takes few sessions. The initial orientation phase will take 1 or 2 sessions, and then the working stage will take another 2, 3 sessions. Finally, when they come out with the real ending of the stage only, the real acceptance, assertiveness, everything will be gained from us to them. Fine. So next, avoid use statements that blame the other person. That is very important techniques, and using humor wisely. So humor is a inbuilt one for any person, which gives the high power of resilience. Okay, so humor is that which we have to use it wisely. It shouldn't be hurting, it shouldn't be like a criticizing, but can be used wisely, appropriately wherever needed.
And
Okay,
all these
next.
strategies are in line with the anger management, I guess, because when we move in with the anger management, we have all these. We should not use you statements. We should use I statements. We should
Yes,
not be blaming. All these things come in accordance with the anger management as well. Okay.
yes, yes. It applies for anger management too.
Yeah.
And coming to the body language of assertive behavior, as already told, open body language, they will exhibit confidence and maintain eye contact, the head up, and calm and gentle posture will be there. And the voice will be calm, steady, even, using their own voice and sincere. The talk will be very sincere. It won't be like artificial or a cooked up one. It will be a sincere talk, and reassurance will be given. Okay, this is not going to be your permanent stage. You will recover, you will do well, and you will come out of the situation. Things will change. Like that, reassuring statements should be given to the person, and the voice will be very pitch and tone. It won't be a monotonous. There should be a very pitch and tone will be there. It makes the speech also very interesting. And the words. So how the person feel acknowledged or recognized. What types of words we can use is shall we, what is your thought about it? Thank you. Thank you for your ideas. Thank you for your input. And I want you to be a part of it. Or I need. So I need, I want this or no, like you're expressing your feelings too. Right? And then what is your opinion about this scenario? So like that, so when you say like this, you're giving respect for them, you're valuing their thoughts also. So this type of words can be used, and you can also ask them, tell me why. So so they can feel like, okay, there is a person to hear about it. What is the reason behind it? So like that, we can use such words. Okay, next coming to the setting boundaries. Setting boundaries is very important in assertive communication. Fine. So wherever we are working, the professional boundaries need to be set. Fine. So need quiet time now, and I'm going to focus on work. If someone is going to redirect you or divert you from the current work situation, you can politely say them, I need time to work now. We will focus on this issue later. So that you're giving the other person that you will focus on the issue later, and you're prioritizing your need also, that you're under some other work currently and that has to be finished off. So that like that politely you can say. And whenever you're working in a professional atmosphere, we need to set the boundaries clearly. Don't bring your financial discussions there. Don't bring your house related discussions into your professional working area. That is not advisable. So keep work related discussions only in meetings. Next, same thing. Avoid personal discussions at work and value the friendships. Like, for example, if you don't have a time to speak with your friend during your working hours, you can, the other time, you can say, need a alone time to communicate or replug with you. And we need for a
Have some
personal time.
leisure communication.
Yes. Like that, you can build on, value the friendship, because the valuing a person comes only when you spend time with them. So that is very important. The next thing is using I statements in assertiveness. Fine. For example, I am not in a right mood now, but the other person want to speak. So I know if I'm going to speak now, I may shout or my mood is not under control. So I can say, I feel I'm not in a right mood at present. Can we speak about it later and sort it out? So, or else I can give them, can we speak after 1 hour and sort it out? So, like that, when you give a timeline and you also see how you feel, say how you feel, the other person will also realize, okay, they will also accept, okay, they are not in a right mood to speak now. Because when we are not in a right mood to process, definitely the outcome of the words will be not convincing for both parties. So it's always wise not to speak in a urge or in a heat of an argument. It's wise to pass the argument by assertively delaying it or giving time for yourself, so that you will not be portrayed as a unwise person. And other things in work related areas, our manager can ask about a person who is always late to office. How they can ask means, I feel worried that you're late. Is there anything wrong with your vehicle or your travel? I'm really worried about it. So in that way, they can ask what is the reason. And as a subordinate, how they can communicate assertively means, I feel disappointed when my efforts are not acknowledged. Like these phrases they can use. Fine. Because the person is working there for a 5 year period of time. That's no promotion, there's no increment. The person can't went out as an anger. They can't shout. It is going to go in vain only. It is not going to be a profit for the person. But instead, what they can say, I feel disappointed when my efforts are not acknowledged. So here, his feelings and his own efforts and the other parties not acknowledging, everything covered in one statement. So that is a clear phrase for the authorities to reconsider about the person's efforts. Fine. So there is no need for unnecessary dramas or unnecessary lack of energies. Okay, so in our I statements, what are the things we can use is I feel hurt when you ignore me because it seems I don't matter. I'd like us to talk like we used to. So we can use all these things. I, when, because, I had like to. These four mm, words are very essential while using the I statement. So I followed by your feelings. And then when. When means it is followed by when the other's action, when you ignore me. Because it seems I don't matter. Because the consequences is I feel like I don't matter. I would like to. Then finally, the person ends with this own suggestion. I would like to talk like as we used to. How we used to speak the previous days, the same like same manner. I would like to continue the communication. Like that, the person can end up the I statement. And finally, there are three C's of assertive communication: clarity, confidence, and control. So, clarity, we all know, as already said, expressing thoughts, feelings, and needs clearly and concisely to prevent misinterpretation. Okay, so clearly expressing your thoughts in such a way that the other person will never misunderstand. That is clarity. Second thing is confidence. That is maintaining the eye contact, using a steady tone, the pitch, the voice, everything should be synchronized with what you speak. That is confidence. The final thing is control. You, whatever the external trigger, whatever is the challenging situation, you know you can control your own thoughts, words, and behavior. So this is very important, taking control of yourself. These are all the three C's in assertive communication. And is there any question?
Um, One more thing I wanted to ask. See, we all have a preset mindset that it's a like it comes from generation. So, which is there any gender difference in assertiveness? Like one gender is more prone to being assertive, and the other one is like very subtle. Is that something like that, or it is like universal? Everyone is being assertive. Nowadays, the trend is changing, but there is, I think, there is some gender difference in assertiveness as well.
In previous era, previous decades, maybe we can say the men dominating society, the men were more assertive. That was the general judgment. But now it's not like that. People who are at home, or working or not working, men or women, anyone can be assertive. The cultural influences, to some extent, it is boosting up assertiveness, but it depends upon what to say, the way you are brought up, the family you are brought up, the ethics, the values, the respect system, whatever is given to you, whatever the child is nurtured with, definitely the virtue will be shown in the coming ages. So cultural influences are there. So it depends upon each practices, societal norms, everything is there. So we should be assertive. Sometimes we are like, assertiveness is what, being cautious about themselves and also being cautious about others' rights. That is a simple term. So of assertiveness. So that is improved a lot. Now all are assertive. To some extent, all are so education is also helping the individual. Even a school kid is assertive than a
Yeah.
working people. They are more assertive. So education is important in building assertiveness, and the parenting style is very important. And the societal norms, the elders' input is there in bringing up a assertive kid. So everything is a collective contribution to build the assertiveness in a individual.
Thank you so
Okay,
much,
so
ma'am, for your precious time. And this was a very valuable session for us. So,
thank you.
I think with this we can end up the session. Thank you so much for being with us.
Thank you so much, Arshia, for this platform. Meet you soon. Thank you.
Thank you.
Bye.
Bye.